Okay, we now hello students. We are now moving to chapter 7, maternal, infant, and child health. Now you can see the relationship between this chapter and the previous chapter. The school age child, the community. What does the community have to do to making sure that the child that is ready to go to school? And one of the ways to making sure that the child is ready to go to school is the child is healthy. The environment in which the child grows is healthy. The support system from family to the rest of the community is healthy. And yes, the child does not go to school hungry or stay in school hungry, because a child who is hungry has the possibility of really not learning that much, because the child is hungry. Or a child coming from a home that is not safe also have the ability of not being attentive in school, because even though they might be in school, they may be thinking about what is going on at home, what is going to happen tonight. So it takes far more than just sending these kids to school. If we really want to have the real benefit of the resources that is poured into these schools, first of all, we have to make sure that those conditions that makes it possible for the child to learn are being taken care of. The home situation, safety home, supportive home, because the home has to be an extension of the school. What the child learns in school should be reinforced at home. The home and the school should work hand in hand, so making sure that the school age child has a better chance of learning. And yes, his physical and mental health, social health should be in place. So make sure you really spend time to read and chapter 6. Now we come into maternal, infant, and child health. Very, very important. Maternal, the health of the mother. First of all, one thing you have to bear in mind is pregnancy should never be an accident. People like to come up with that excuse. Oh, well, it was an accident. No, it shouldn't be that way. You should make sure that you plan for it. Hear what I'm saying, you plan for it. You make sure the mother is healthy. Mother stays away from drugs, alcohol, eating bad food. The mother should be well fed. Good nutritional diet. less stress. See, because those are the first things the mother has to make sure that she is healthy. Because the infant, once the mother becomes pregnant, that embryo, the fetus, stays with the mother, eats whatever the mother eats. If the mother smokes, there goes the health of that child. If the mother drinks alcohol in excess, there goes the health of that child. If the mother is overweight and not really controlling her weight, there goes the health of the child. So there are certain things that really has to be taken care of. First, take the health, take care of the health of the mother, so that the mother can be able to have a healthy child that can grow to be a healthy infant, then later on a child, and a one that can ready to go to school, do well, grow up to be a young man or a young lady, and be a productive member of society. So these are some of the objectives. After studying this chapter, you'll be able to define maternal. What does maternal mean? What does infant mean? And child health. Explain the importance of maternal, infant, and child health as indicators of our society's health. So let me read it one more time. Because of their level of discussions that we've gone through some of these chapters, the health of the people in the society is a good reflection of the quality of the society. The health of mothers is a quality of the health of infants and children, and to a great extent also the men, because the role of women in society is exceedingly important. There's no role that can even go close to that of the role of mothers. So when mothers are taken care of properly, from young ladies to young mothers, if they are adequately taken care of, they will give birth to healthy babies. And healthy babies will grow to become healthy children, and later on become productive members of society. So if there is a poor maternal health, there is that direct correlation that that society, that community, that environment is a poor, does not really take care of its individual, of her people. Extremely important. Define family planning and explain why it is important. Family planning, depending on people's value system, their religious beliefs, most of the time, they have different opinion about this kind of family planning. But if people should choose to engage in family planning, it should be done the right way. You see, because most of the time, as I said at the start, pregnancy should not be an accident. Because most of the time, as grown-ups, without even taking any class in biology or human sexuality, a healthy female and a healthy male, if they engage in sexual activities, the probability of the female being pregnant is very high. So at times, people should stop taking those chances. Identify consequences of teen pregnancies. Most of the time, again, we will discuss some of the impact when teens become pregnant. How does it impact the mother, the teen mother, and how does it impact the teen child, infant? Define legalized abortion and discuss Roe v. Wade and pro-life and pro-choice movement. Again, these are discussions that have been going on for quite some time. You have some religious beliefs that do not really favor legalized abortion. And most of the time, this idea of the legalized abortion can be monitored if pregnancy is not considered an accident. Or at times being impregnated by somebody who either through forced sex, rape, and all those situations that should really make it very, very difficult for the mother to even think of carrying that baby. And you have some religious beliefs who say, okay, regardless of what, it's pro-life. Even if the child is, the mother is raped, or the child is born will be born with some defect, that child should be born, brought to life. And you have some women who is their choice, their body. They will do what they think is appropriate, what they want to do. See, some of these things are it all depends on the person's moral views. Define maternal mortality rate. How many women die during giving birth or immediately after giving birth? And when you compare it to races, the maternal mortality rate among whites and blacks, there's a gap there. Why is that gap? Why does that gap exist? What needs to be done so that there is no gap? If the pregnancy is maintained, a healthy pregnancy is is developed all through the way to delivery. Why should it be at the point of delivery? Black women are much more likely to die during delivery or immediately after delivery. These are things that needs to be taken into consideration and addressed appropriately, because there is an equity there. There is a gap, there's a disparity here, and it needs to be addressed. Define preconception, prenatal care, and the influence this has on pregnancy outcome. Again, what you do before you conceive, and how often do you go for medical checkups? What is the relationship between you and your doctor? How intensive is the care you get based on your condition will almost always determine the outcome. List major factors that contribute to infant health and mortality. Explain the difference among infant mortality, neonatal mortality, and postnatal mortality. Identify the leading cause of childhood morbidity and mortality. List the immunization required for a 2-year-old child to be considered fully immunized. Explain how health insurance and healthcare service affect childhood health. Identify important governmental program developed to improve maternal and child health. Briefly explain what WIC programs are and who they serve. Identify the major work group that are recognized as advocates for children. So this is very, very important that we really understand some of this, the importance of really having healthy mothers giving birth to healthy kids, because that's the only way we can continue to continue the generation. Because when mothers are not healthy and don't give birth to healthy kids, most of the time longevity is compromised. If we want to increase the generation, from one generation to the other, health has to be the paramount factor that needs to be addressed. Okay, here introducing age-related profiles. Helps identify risk and target intervention. Here, infant greater than 1 year. Children 1 year to 9 are called children, referred to now. So using these age-related profiles helps identify risk and target interventions. An infant is one that is less than 1 year. Infant, less than 1 year. Children, 1 year to 9 years. So whenever you hear the word being used, an infant, it means this is a child who is less than 1 year. When you hear children being used, it means we're talking about somebody within the ages of 1 year to 9 years of age. Maternal infants and child health, MICH. So when you see we use the word maternal infant and child health, it's MICH. One thing you can know in public health or in health, it's a lot of abbreviations, you know. So maternal, infant, and child health encompasses health of women of childbearing age from pre-pregnancy through pregnancy, labor, and delivery, and the postpartum period, and the health of the child prior to birth through adolescence. So when you see the MIC, you always have to be this is you talking about the maternal, infant, and child health, which really deals within a range of a period of health of the mother, of a childbearing age. Most of the time, again, there comes the issue. Some kids, studies have shown, some kids have been become pregnant at the age of 10, 11, 12. Even though they have those secondary characteristics, but that child is not fully developed to be able to carry a healthy pregnancy. So these are all things that we'll talk about. And where are these very early teen, wherein these kids become pregnant, very early teen pregnancy? What are some of the environmental conditions? As we said, you know, in the last script, that the health of the mother and the child says a lot about the society in which they exist. So it encompasses the health of the mother of childbearing age from pre-pregnancy through pregnancy, labor, and delivery, and the postmortem period, and the health of the child prior to birth through adolescence. So now, instead of using the maternity, infant, and child, they say the MIC health. The MIC statistics are important indicators of effectiveness of disease prevention and health promotion service in a community. Decline in US MIC mortality in recent decades, but challenges remain significant in racial disparities. Even though there has been a decline nationwide when you mix white, black, and other minorities, but it's still a problem within racial groups. Going back to that old disease, the disease of they don't look like me, therefore I'm not so willing to spend so much resources on them. And at times, lack of education, lack of opportunities that subject some of these women into, especially within racial communities, to engage in sexual activities that can lead to pregnancy, even though they are not prepared. Say, now look at some of this. Some of this, if you want to really go through, get the full data, you can see different colors. It's always small when you think of the disparity within the groups. The infant mortality rate by race and Hispanic origin of mother. United States from 2005 to 2013. So you can see. Same again, most of the time, there is, when you think of infant mortality rate, death rate of infants, most of the time there is a discrepancy between male infants are at a higher rate of dying during infancy than female. And you can see when you look at it again, blacks, male infants are at a higher rate of dying than female. And when you mix the American Indians, the Alaskans, you see the total. There is the African male is at much higher rate or much higher chance of dying at infancy than an other male counterparts of other ethnicities. Family reproductive health. Families are the primary unit in which infants and children are nurtured, supported regarding healthy development. So most of the time, these are certain things that when we start talking about childbearing, the family carries most of the burden of making sure that when a child is born, the mother is taken care of properly, the child is taken care of properly. Yes, the government can intervene, but most of the time, the family are the primary unit. They are the first people who can make sure that the child and the mother are taken care of. So the government and other entities can support. So various definitions of family. What does family mean? Concepts have changed over time, depending on social and cultural norms and values, may be conceptualized differently on an individual basis. At one time, people living in the community were all considered family. Everybody was equally responsible for the well-being of each other. But today, some of those opportunities are far gone. That social unit has been fragmented. Now it's when people talk of family, it's maybe the wife, the husband, the child, maybe an uncle or aunt, and going too far. But again, that saying, it takes a village to raise a child. That is just not a cliche. It's real. It takes everybody within the community to play their role in raising the offspring, the children of that community. And most of the time, some of it is just so kindness, just so love, so caring. Yes, if you have means, so show some support. Because most of the time, when the society does not play its role, later on, that the kid grows to be problematic, they all have to bear that problem, regardless of whatever might happen. So again, even though civilization or some of the social pressures or some of the, it's really creating some challenges, but when it comes to children, everybody within that society should be invested. Research indicators: unmarried women are more likely than married women to experience negative birth outcome. First of all, you think of the emotional support. how serious is that support? How serious is the resources? Because unmarried women, do they have a home? Do they have regular meals? What is the relationship between the perceived father of the child? Or what is the role of grandparents trying to help out? So most of the time, what is the support system to go see the doctor for medical checkups? Does she have insurance? See, when an unmarried woman becomes pregnant, there are so many hurdles that makes it very, very challenging for her to experience a positive birth outcome. In general, they generally experience a negative outcome. Married women are more likely than unmarried. Non-cohabitating women to initiate prenatal care early in pregnancy. See, because most of the time is they are married. Those who not the impact, first of all, part of being married in most cases, everybody is expecting them to have kids. And they're looking forward to the opportunity of having kids. So very early, they start talking about, okay, what are some of the prenatal care? When should we go to the doctor for checkup? When they start discussing this early. When should we get a crib? When should we this? All these things that they need to do to making sure that when the child is born, the child is born in a caring and a loving environment. It does not mean unmarried women do not have the care and the loving environment. It just means at times the resources are not there. And love alone without the resources, it's a challenge because there are a lot of unmarried women who have raised great kids who become successful. But they, most of the time, they did that with the help of their own parents and some other family members. It's much more challenging to do it on your own. Married women are less likely than unmarried or non-cohabitating women to rely on government assistance to pay for prenatal care. In most cases, those are married, have insurance, or some form of insurance, either from work or some, so they have the ability to pay for prenatal care, go for medical checkups, go as often as is needed. Especially in today's climate, wherein people, this is very, very risky for women. This cohabitating. You see, cohabitating, it's a much time, oh, well, nobody is committed to this. But in case of pregnancy, yes, the woman needs the man to be committed. And if you're not married, or you are cohabiting, you are staying together, you do everything together, that man can walk away. So most of the time, cohabiting is a risk that women really have to be very, very careful how far they engage in those kind of things. Teenage birth, teenage pregnancies more likely to result in serious health consequences for mother and baby. As I said, teenage, structurally, they are really not fully developed, even though they have the ability to be pregnant. They are not physically developed, emotionally not developed. To be making rational decisions for themselves as well as the baby. So most of the time, some really have serious health consequences for the mother as well as the baby. In some situations, you have low birth babies, low weight, and complications during the delivery, wherein the body, the various part of the delivery process, the birth canal, is not fully developed to really carry out its functions during child delivery. Teen mothers less likely to receive early prenatal care. Why? Most of the time, they are afraid because, as I said, it could be an accident. Afraid to tell their parents. Until when it's about 4, 5, when it starts showing, now it's too late. They could have gone for some medical checkups that could have, helped them to be able to carry a healthy pregnancy. Teen mothers more likely to smoke during pregnancy. Again, pretend as if life is normal. No. During pregnancy, life is not normal. Your life is now, you are whatever you do, you're doing for two. If you have twins, you're doing it for three. Whatever you eat has to be healthy. Smoke is not healthy for you and it's not healthy for the developing child within your womb. Smoking is not. Of all the things that mothers should not do, smoking is one. Don't smoke when you are pregnant. because it goes directly. That infant developing in your is inhaling the same amount of toxic stuff that you inhaling. So teen mothers should not smoke. And most of the time have the possibility of preterm birth, wherein they have this premature birth. Child not fully developed, but just cannot be maintained. Full pregnancy cannot be maintained, and the child is delivered. And in most cases can have a low birth weight babies. See, when the child is not fully developed, the organs of the child are not fully developed. You see those kids being, to keep them alive, they have to use so many advanced machines to take the place of the womb. Because usually healthy pregnancy, everything being normal, is 9 months. But at times, in some cases, at times it happens 6 months, 7 months. That's a challenge. And most of the time, those kids end up having some developmental issues. And again, teen pregnancy have pregnancy complications. So 1/4 of teenage girls get pregnant at least once before age 20. So which means they start engaging in sexual activities at much younger age. Teen who become pregnant and have a child are more likely to drop out of school, especially if they don't have the support system. Kids without the support system will drop out of school. Not yet married, or have a marriage end in divorce. See, so early child pregnancy for teen increases their chances of never being married, or if they end up being married, that marriage will end up in divorce. Because some men will not want to take care of another man's child, or some other issues. So it's advisable for teens to avoid some of these possible challenges, to wait until they are fully developed physically and mentally, and also have the right type of relationship, so that whatever happens, the husband or the guy and the girl will be able to take care of the kids. Kids, teenage who get pregnant, most of the time rely on public assistance. Because again, especially depending on their level of skills, they cannot afford to take care of a child on their own. So in a way, it starts that kid living in poverty, and most of the time, depending on the society in which they live, the community, not only live in poverty, but also increases the chances for other social ills that can impact the child and the mother. Substantial economic consequences for society. Say because when these kids are not properly nurtured, do not have the ability to complete school. There are times they are likely to be influenced by the wrong people. And this can lead to life of crime and people die at much younger age. Family planning. Determining the preferred number and spacing of children and choosing the appropriate means to accomplish it. It's your planning. How many kids do we want? And how should we space them? There are different ways. You have some religious ways in which it's being done without using chemicals. And there are some ways in which people use chemicals. Community involvement in family planning and care includes governmental, neo-governmental organizations. Okay, and read the rest and the chapter up to this point. This is very, very important. And this is an important chapter simply because it involves the health of the mother, the health of the infant, the health of the child. And that child in future becomes the grown-up. They will have to start their own generation. So most cases, it's better to start right so that you don't have to do a lot of cleaning up. It's very, very important for us to take some of these things into consideration. Okay, and you have a nice one. And I should be posting the study guides for the midterms. You take care.